purpose of this video is to demonstrate the new nursing blood administration documentation process. Within Care Compass, you will go to your activities to view the task for blood transfusion. When this task is highlighted, you will notice that the Document button no longer highlights. You only have the ability to select Done or Not Done. To document your blood transfusion, go to the patient's chart, open the chart, and navigate to IO INET. Within IO INET, you will notice there is a new band labeled Blood Product Administration. Open this band to view documentation for vital signs and also your documentation for your blood transfusion and blood volume. Once you have obtained your blood product from Blood Bank, you will come into the chart, open Blood Product Administration to document your pre-transfusion vital signs. Open the vital signs field and begin your documentation. After documenting your vital signs, navigate to blood transfusion, blood volume. As in the past, you will still utilize the dynamic group to open and document the blood product you are administering. Click the dynamic group icon to open and begin your documentation. From here you will notice that all the fields within this window are now yellow and mandatory fields which have to be completed before you can select OK and move on with your transfusion. Click your cursor into the blood unit ID number field and using your scanner, scan the blood product label to populate the blood unit number beginning with the letter W. Next you will select the blood product type, the blood unit type, move on to any applicable blood unit attributes, and enter the expiration date on the label of the blood unit. With your nurse witness present, verify that this information is 100% accurate. This cannot be edited once the transfusion is signed. Once you've clicked OK, you can begin documenting your blood transfusion. Start with patient verification and select these witness required fields. Next, the blood patient type, cross-match interpretation compatible, blood administration equipment used, blood transfusion site. One change in the process is the blood unit activities field. The change in this process indicates whether you are initiating or discontinuing a blood transfusion. This replaces your start and stop times. To initiate, click Initiate within the documentation field. You will now get a start date and start time. Once you enter your transfusion start time, you can now sign your documentation to activate the second nurse witness signature. Have your second nurse witness enter their name in the first field. You will notice that all fields populate, eliminating the need to fill the name in each individual field. Before you click OK, verify that all information is correct before starting the transfusion. Please pay close attention that all attributes of the blood unit itself are correct, and particularly the expiration date and time is exact. Click OK and then witness sign. You have one more chance to review your results before the final signature. Have your second nurse witness enter their username and password and click OK. Once your second nurse witness has signed, you can return to IO INET, go to the Blood Product Administration band, and complete your 15-minute and your post-transfusion vital signs. When your transfusion is complete, go to Blood Transfusion, Blood Volume, select Blood Unit Activities, and discontinue. This will open up the transfusion stop time field for you to accurately document the transfusion end time. Please note that if your transfusion did not complete, you have the ability to document in these fields. Also, when your transfusion is complete, under Blood Unit Treatment Response, there is a free text field to document any pertinent information regarding your blood transfusion. Before signing your documentation, make sure you take credit for the volume infused during the transfusion by selecting next to the appropriate field and entering the blood volume in milliliters. Next, sign your documentation. Then right-click on the blood unit ID number and inactivate your documentation. Return to Care Compass, select Activities, and locate your transfusion task. Select the transfusion task and select Done. This will remove the task. Please use this video as a reference for documentation of any future blood product administrations. Thank you.